Thank you, Minnie. Next, we will have a fireside chat focused on AI in health. This session explores market forces and technology breakthroughs that are leading to the emergence of intelligent health systems that leverage AI to drive better experiences and outcomes for customers across all channels and touchpoints. We have two speakers who are stalwarts in the healthcare domain. Parin Dalal currently leads company-wide strategic AI decision-making at Varian Medical Systems in his role as Vice President of Advanced AI. He holds over 50 patents, which have either been granted or pending approval. Tom Lawry serves as National Director of AI for Health and Life Sciences at Microsoft and previously served as Director of Worldwide Health. His book titled Artificial Intelligence in Healthcare, A Leader's Guide to Winning in the New Age of Intelligent Systems was a 2020 bestseller. I know we are running a little bit late, but you get your extra 2 points, Parin and Tom. Over to you, Parin.
Thanks, Lalit. So Tom, you're the National Director of AI for Health and Life Sciences at Microsoft. So you must work with a lot of leaders, both clinically and in policy, around the adoption and use of AI. So what are you seeing in large health systems about redefining the patient relationship or flow?
Well, great question. And first of all, great to see you. So I serve as a strategic advisor to a lot of very large provider, payer, and life science organizations. And what we're really seeing today is a big push using artificial intelligence across the spectrum: clinical decision support, operational and financial performance improvement. And probably the best thing to do is just bring us back to the world's a different place than it was a year ago. And so COVID taught us a lot of things. It taught us that when under pressure, healthcare is capable of agile transformation. It also showed that AI can have a fast time to value when it comes to how it's used. So think about the patient experience and how it changed with things like the dramatic increase in the use of telemedicine and virtual visits, remote monitoring, a lot of digital collaboration taking place between clinicians and consumers. Taking that to the next level, there was a study by Change Healthcare and the Harris Polling Organization that was saying that of those surveyed, when it comes to accessing, going through, and paying for care, it's such a hassle that half just decide not to do it at all. So we've made good progress, and we've got a ways to go when it comes to taking intelligent systems and improving that patient experience across the board. So that's my quick answer. So let me turn the table. So Varian is now part of Siemens, and Varian's always been a leader in the industry, and you're now paired up with another great leader. Intelligent imaging is one of the hottest topics today when it comes to AI. Siemens and Varian are both very well positioned. So tell me some about what you're doing and where do you see that going?
Thanks, Tom. It's good to see you as well. So imaging becomes intelligent in three major categories. The first one is diagnosis and wellness, I would say. Even though they're very discrete, they're before intervention, which is the second category. And then finally, in follow-up. So I'm worked mostly in the interventional space. We work on trying to kill cancer without killing people, which means we need to be able to target and control to hit cancer and spare and avoid those things that are essential for our livelihoods and our well-being. So in that spirit, I work a lot on reinforcement learning, which is redefining control theory almost across the board, not just in healthcare. And then secondly, diagnosis. I mean, honestly, diagnosis would have been a solved AI health problem if you have dense, accurate, representative, and complete data, right? As sometimes you do for traditional types of AI problems. But in healthcare, none of those are true. And because of that, a lot of intelligent imaging and diagnosis has to be with how you deal with data. Given that you have sparse and noisy data, what tools are you going to develop to actually leverage them? So you won't be able to use off-the-shelf AI in an effective way. And then finally, in follow-up, this is really out of hospital care when trying to decide when to bring people back in and to make sure they come back in when it's emergent. It's also really important to try to provide them some level of care outside. And this is where I think telehealth, intelligent imaging is the easiest, lowest bar to cross. Um, yeah, and so I think finally, I think there's going to be a lot of work in outcome data and causal inference, but I don't think intelligent imaging is going to be involved in that for some time.
Yeah.
So
Yeah,
that's
so
my
as you're
long
talking,
answer.
no, that was not long at all. Well, I guess for the time slot we have. So no, I love your answer. And yeah, anyone who works with data, have you ever had a data set that's just the way you want it to begin with? And some of those challenges. I also love the idea of the intelligent imaging as it cuts across increasingly, that care anywhere that everyone's moving towards.
Yeah, I think that's a really astute point that we need to be able to think about the data as much as the algorithm. That data really is the lifeblood of AI. And speaking of the sort of guidance and direction, Tom, you have a book out now. So a book came out from HIMSS that focuses on AI, and in that book, you call out an emergent trend, something you've termed intelligent health systems. Can you tell us what is an intelligent health system, and how does it impact the patient experience, or at least how is it going to change it, or is different than sort of the salient experience today?
Yeah, so when I think about traditional provider organizations today, all shapes and sizes, everyone's moving towards artificial intelligence. The key, though, is I believe there's this emergence where as AI becomes more pervasive, the creation of what I call intelligent health systems is very different than traditional health. So in traditional health, what we're seeing is investment in maybe a few use cases that actually provide value on predictive analytics and other things within, say, clinical decision support. An intelligent health system can be any entity, a large health system, a public health department, that basically gets the value of artificial intelligence, and they use it to create efficiencies. But the operative thing is they do so across all touch points, channels, and experiences. And what they're really doing is reinventing those clinical, operational, and consumer workflow processes based on the value of artificial intelligence. So those who get that are moving in that direction to be able to do agile transformation at scale across an enterprise. And underneath that, there are certain things that they're automatically doing when it comes to leaning into AI, including what you were talking about earlier, of investing first in things like creating and managing a modern data estate, which really turbocharges all of those agile transformation activities that come with artificial intelligence. So now that I've said that, and I believe that's where we're going, honestly, as I look at the market, any way you look at it, AI in health and medicine is a very hot topic. It's also an area that, if you look at any of the studies, is where a lot of money is going from VCs. But, the reality is there's a lot of hype involved in AI in general, and then specific to health. And it's what I call the shiny object syndrome. So, what's your take specifically on, how do we separate out that hype from what's really going on in health and medicine?
Yeah, that's a really good point, Tom. And the statistics I've seen suggest the same, that an inordinate amount of venture capital is being pumped into the healthcare specific niche of AI, and it's good, it's great, it's a really fertile field. But this is a really important thing: is what's real and what's hype. And for me, when I look at a new company or new technology in AI, there's really four sort of dimensions that I kind of add up. One is around, do they have a very clear set of billing codes for what they're going to do? Are they trying to reinvent like how you pay for healthcare, which might be a big, ambitious project, but if they don't have like a clear set of billing codes, they may not be thinking about the patient flow in a realistic way. The second is, how are they going to pass through regulatory? If you're working in general wellness, then it's a lot easier, right? But oftentimes where you want to make the highest impact, it's for those that are sick and that need help. And if you're going to go through an interventional route, you need to really think through regulatory policy in a hugely changing landscape. The FDA is really trying to figure out how to regulate AI now, and they don't have all the answers there, and they really need to move along. They've been doing a great job in the last couple of years, but there's a big gap. And the third way of thinking about it is what we just talked about, which is data. And so oftentimes in normal AI companies, you think of them being viable when they have a niche data set. They have something different about their data that's proprietary or is captive to that company, and they can leverage it. Because otherwise, it's really easy to use off-the-shelf algorithms for dense, dense data. That's not really a barrier to entry, or it won't be something that someone hasn't done already. And the final thing is, are they trying to learn too many features? So this is a big thing between hype and reality is if you're trying to learn so many features, you need that much more data, and it becomes intractable. People should be ambitious, but oftentimes you need to be very quantitative about what is the feature space you're trying to learn, and do you have data, or will you procure data that will support that space? And so that's kind of how I kind of slice and dice the hype.
No, I think it's a great framework, not only for hype, but if you're an investor, I think there are some great kernels in there about the proof points to look at if you're looking at anything that relates to AI, particularly going into health and medicine. And then a couple of other things. You talked about reinforcement learning earlier. I mean, that's the sort of thing that, and FDA is doing a great job of trying to get their arms around this. But when you look at things like reinforcement learning, and then you look at the traditional way that something is certified as a medical device, that's the sort of thing that makes regulators' heads explode. But
Yep.
And then finally, and then I'm going to pose another question to you. As you were talking, I also think it's interesting to take what you talked about and look at what seems to be emerging. So I'm sure know last fall was the first time that CMS actually approved an algorithm to be reimbursable. So every time it gets used in the context of that clinician experience, someone's actually going to get paid. So when I look at the criteria you put out, I think where we're going eventually is, looking at that monetization model for those algorithms, which I believe is going to be another key criteria. So following up
Absolutely.
on what you said, look, we've talked about hype. You're deep into a lot of things, and I mean, 50 patents. Come on, that's slow down, man.
Too many.
But seriously, you have to have a take on. I mean, there are certain things where AI is infinitely suitable, and there are other things that, and oftentimes, I have my own criteria. When I hear people say that they're going to attack something with AI, my questions start going off. So, I mean, give me your thoughts of examples for those things most suitable for AI to address in health and medicine, and which things maybe someday, but not today, are really not good examples.
That's a great question. And it really anchors off the last thing I said, which is around the feature space. And so, what's a clear example of something that's failed? So let's talk about multi-omics a little bit. So multi-omics can be really, really inspiring. It can provide new markers that traditional medical markers had no vantage point over. But some ways of thinking about multi-omics are really hard to think of as plausible. So for example, those multi-omics which work in an extended feature space. So if I add another multi-omics, for example, if I try to do imaging to reinvent personalized diabetes treatment, you're mixing one set of features that are completely unrelated in traditional medicine to another set, and your hope of being able to multiply the Cartesian product of those features and find something is pretty improbable. And so those folks, like for example, like HLI, right, spectacular failure, even Longevity Institute, and they kind of said, let's keep putting more and more omics, and we'll try to take all this gobbledygook and turn it into something that's actionable. The idea that you're going to do that off the cuff, it's a hard thing to swallow. So I'd say the things that are least likely to have AI solutions are those which attempt to take modalities that have producting feature spaces. It's not very good. The others are the very constrained ones, where you add modalities, your feature space is much easier to learn. And so, for example, if to plug my own pass, like if you add heart rate to glucose monitoring, those are two sides of the same coin. You're taking glucose syncing and glucose production. Sorry, I'm having some folks over right now. So this might be a good time for me to ask you a question, Tom. And I think the popular question of the year is around maybe something like COVID. Like COVID is something where we've probably learned a huge amount. We've probably got a huge amount of data, and there might be another pandemic, right? And there might be lots of strains of COVID. What do you see going forward as the role of AI, or just in general with COVID?
Yeah, I'm going to go fast because I think we're almost at the end of our time. So COVID taught us a lot of things, including, again, health leaders and healthcare is capable of agile transformation when they need to be. We also learned that, again, AI can produce rapid time to value when properly curated and applied. And finally, Microsoft and The Economist just published a report this week that really looks at more of the deeper implications across all industry, but especially healthcare. And two of the things that report shows is those healthcare organizations that were deeper in cloud and AI had a much better time navigating the change we all went through. But also showed that it was easier to transform work processes to help support clinicians when they already had some of those things in place. So that's a report. Anyone, just go out to any search engine, type in The Economist, Microsoft, and the transformation imperative, and you should be able to access that study. So I'm going to guess
Awesome.
we're running out of time, Parin.
We are a wonderful conversation.
I with you more, but I know we've got many other good speakers. So Parin's up in Sonoma. I'm down in Carmel. Maybe we can get a support group together somewhere in the middle to continue the conversation.
All right.
That sounds great. Thank you.
Hey,
Thank you so much.
Thanks, Tom and Parin. I'm in between both of you, so we can meet in South Bay.
Right.
So again, it was a wonderful overview on AI in healthcare. I know last 1 year has definitely accelerated our wishful thinking collectively in accelerating AI adoption in healthcare and life sciences. And I wish we had more time, but yeah, maybe sometime later. Okay, thank you. Thanks again.
Thanks a lot.
Thank you.